Good afternoon, everyone. I'm Nirav Shah, the director of the Maine Center for Disease Control and Prevention. I'm joining everyone this afternoon to provide you an update on where we are with respect to COVID-19 across the state of Maine for today, Tuesday, January 26th, 2021. I begin today's update on yet another sad and somber note. The Maine CDC has received reports of 11 additional individuals who have passed away with COVID-19. 1 from Aroostook County, 5 from Cumberland County, 2 from Hancock County, 2 from Kennebec County, and 1 from Penobscot County. 1 of them was in their 70s and 10 of them were in their 80s. 6 of them were women and 5 were men. Their latest deaths bring in Maine the total number of people who have died with COVID-19 to now 558. And their deaths come reported to us on a day when, as a country, there have been now over 422,000 deaths associated with COVID-19 across the United States. 422,000. That number is almost too large to contemplate, too large to appreciate. When you think about it relative to other major tragic events that have transpired across our history, that number of deaths associated with COVID-19 becomes even more concerning and saddening. The United States has now recorded more COVID-19 deaths than the number of American soldiers who were killed during World War II, which itself was the bloodiest war in human history. According to the Department of Veterans Affairs, the United States saw 405,399 service people who died during World War II. As of this morning, as I mentioned, 422,500 COVID-19 deaths had been reported in the United States alone. That's based on data compiled by the US CDC, to say nothing of the staggering number of deaths that have occurred outside of the United States. When you take a look back on the last year of COVID-19 deaths that have occurred, you see a gradual and increasingly tragic timeline unfold. By April of last year, April of 2020, the pandemic had already killed more Americans than the Vietnam War. The Vietnam War claimed the lives of 58,220 Americans who died in nearly 2 decades of combat in Vietnam. By May of last year, the United States COVID-19 death toll had already surpassed the combined number of Americans who were killed in battle in every major US war since 1945, which in May then stood at 87,000 people. But now, with over 422,000 deaths, the number of Americans killed by COVID-19 is more than half the entire death toll of the entire Civil War, which itself claimed the lives of 620,000 Americans. Based on where we are right now, the open question on the table is how much worse things will get. We'll talk in a bit about where we stand about vaccinations. But I want to offer these numbers, as sobering and as saddening as they are, to ask us all to remind and take care as we are going through our days. COVID-19 has already claimed the lives of too many Americans. Where we go from here as a country and as a globe squarely depends on us. In 1968, which was the deadliest year for the United States in the Vietnam War, the death toll that year alone was 16,899 US servicemen and women who died in the Vietnam War. Think about that. Right now in the United States, with nearly 3,000 deaths per day, we are repeating the Vietnam deaths of 1968 that occurred over an entire year. We are repeating them every 5 to 6 days just in the United States, just from COVID-19. Where we go from here is up to all of us. And again, as we'll talk about in a moment, the arrival of vaccines presents hope, but we still have much to do before vaccines present that hope to us in a way that reduces the number of deaths every day. Turning now to cases. Right now in Maine, there are a total of 37,708 total cases of COVID-19, an increase of 662 positive cases since yesterday. Of those, 30,496 are confirmed cases and 7,212 are probable cases. Cumulatively, over the past year, 1,357 people have been hospitalized. And right now in Maine, 194 people are hospitalized with COVID-19. 59 of them are in the critical care unit and 25 of them are on a ventilator. Now, in terms of our testing, our positivity rate has continued to come down over recent days. It now stands for PCR tests at 3.64% over a 7-day average basis. That is in part because the volume of testing that is occurring across the state has continued to go up. Our testing volume across the state of Maine now stands at 764 tests for every 100,000 people, which is close to the highest level it has ever been. Similarly, with antigen positivity rates, there's been more stability. The antigen positivity rate now stands at 6.53%, with about 165 antigen tests being conducted for every 100,000 people in Maine. I'd like to turn now to some updates on outbreaks. Starting first with outbreak investigations that Maine CDC already has opened, that I'd like to provide some updates on. The first is an outbreak that we have been working very closely with our colleagues at the Maine Veterans Home in South Paris. There are 19 cases of COVID-19 associated with the Maine Veterans Home in South Paris. And as with any long-term care facility outbreak, Maine CDC is working with them to make sure they've got PPE, testing supplies, as well as infection control and prevention guidance. Also, at the SEER bus line in Bangor, we are working with that organization to make sure they are doing everything they can do to keep tabs on an outbreak that right now has registered 8 cases of COVID-19. Turning to new outbreaks for a moment, there are 3 that I'd like to note. The first is an outbreak investigation we've opened with 6 cases associated with the Lisbon Public Works. We've also opened an investigation into the Oxford Casino, where we are aware of 5 cases. Also, having opened an investigation into the Oxford Street Shelter, where we are aware of 8 total cases, 5 of which are among residents, 3 of which are among staff members. And finally, an investigation at the Chimbro construction work site at the VA in Augusta, where we are aware of 11 cases of COVID-19. Turning now to where we stand with respect to vaccines and vaccinations. As of this morning, the state of Maine, all partners across the state, had administered a cumulative 115,213 shots in arms of COVID-19 vaccine. Of those, 89,654 are first doses and 25,559 are second doses that have been administered. I'd like to take a second to talk a little bit about where we stand with respect to vaccines and vaccination. We've had a lot of folks who have reached out to us, as well as healthcare providers and hospitals across the state, asking us when, where, and how they can be vaccinated. That's encouraging. We are heartened by the fact that so many individuals across the state of Maine can't wait to be vaccinated. Indeed, folks will remember just a few months ago, the national conversation was, if there's a vaccine that's made, will folks want to take it? I'm encouraged and really happy that there are so many folks in Maine who have decided that vaccines and vaccinations are the right thing for them. We know that right now, the number of individuals who want to be vaccinated greatly outstrips the supply of vaccine that we have available. And so I'd once again like to ask for your patience. We are hoping, working with our colleagues at the CDC, that more vaccine is on the way. And when that happens, we will be able to turn that vaccine around to healthcare providers in Maine who can then open up more slots and provide more shots into arms. Well, there are a number of questions that we know that have come up that I'd like to address head on. The first is, why can't I sign up and then be contacted when it's my turn? Now, some facilities across Maine, whether they are clinics or hospitals, may already have the ability to do that type of pre-registration now or in the very near future. But as of right now, we are working still to bring on a statewide platform. That platform is being built right now so that once it's live, everyone across the state can sign up, can raise their hand to say, I would like to note my interest in being vaccinated, so that when a vaccine is available at a site that is close to them, they can be contacted. We are not there yet. It is being worked on. And so you might say, well, why aren't you there yet? Well, there are a couple of reasons for that. The first is that the previous administration had plans in place to create just that nationwide unified IT platform that would be available to all states and jurisdictions that would do, among other things, that type of pre-registration. But what ultimately came out, a system called VAMS, didn't meet anyone's expectations. And as a result, the state of Maine and many other states have declined to use it because it did not actually solve the problems we had. As a result of that, all states, including Maine, are looking for other options. I don't want to create a system that merely takes names, addresses, phone numbers, and email addresses. I want to have a system that actually takes those pre-registrations and then allows us to do something with them. In some parts of the country, they have those pre-registrations set up, but there's not a plan in place to take that information and actually bi-directionally reach back out to people when a time and slot is open. As I've talked about before, I'm not the type of person that just does a half a loaf. I want to make sure that when we have a solution, it's a solution where we've played the chess game through to the very end, and it's a solution that actually solves the problem in front of us. We don't have that available yet, but we are working to bring it on. Once again, I do ask for your patience. We want to get it right rather than just get it fast. A related question that's also come into us is, why isn't my doctor's office contacting me so that I can be vaccinated? And the answer there is that some doctor's offices, some outpatient clinical practices will be offering vaccines, but not all. We've decided to try to prioritize vaccine for places that can get as many shots into arms as quickly as possible. When Maine gets vaccines into our borders, our hope is to turn those around and get them into arms as quickly as we can. Some physicians' offices will have the capacity, either on their own to do that sort of high throughput vaccination, or perhaps as a consortium of physicians' offices who get together and offer vaccine to their patients and those in their community on an occasional basis to set up larger scale clinics. Some will be able to do that, but not all. But the other important piece to note is that much of this consideration to focus vaccines in places that can get as many shots into arms as quickly as possible, whether it's an FQHC or a consortium of physicians or a hospital, is driven by the fact that right now we are still extremely supply constrained. This week alone, Maine is getting about 18,000 doses of vaccine. When you compare that against the fact that there are over 190,000 people alone in Maine who are 70 and over, you see right off the bat that there are many more people who wish to be vaccinated than we have doses available. If that were to change, when that changes, when supply is no longer our principal constraint, we hope to be able to provide vaccine far and wide to providers across the state, whether they are independent medical offices or whether they are pharmacies in your neighborhoods. For right now, with such a limited supply, we're focusing on places that can get as many shots into arms. Maybe that's a large throughput public facing site. Maybe it's, again, a consortium. Maybe it's a hospital. Those are the places where vaccine can come in the door, get put into arms without wasting a single dose. Another question that's come into us is, why don't all hospitals have a way to register and get in the queue? Once again, this is only a matter of time. I've had the opportunity, as has Commissioner Lambrew, to speak with hospital leaders of all different types of hospitals across the state, whether they are hospitals associated with big systems or hospitals that are independent, to talk to them about the ways that they are going about scheduling and registering patients. Again, it's only a matter of time before all hospitals in the state are able to register everyone and give them a spot in the line. But this, again, is subject to vaccine availability. But I want everyone to know that this is being worked on, and we hope that those systems are ready and available soon. The last question that's come into us is, this is all well and good, but what if I don't use a computer? We hear that. We understand that concern, particularly in Maine. We want everyone to know that we are setting up phone lines through a call center that can be used by anybody, whether it's you yourself that's calling to set up an appointment for you and your spouse, or maybe you're calling to set up an appointment for your parents or your in-laws. Once again, we want to get this right rather than just get it fast. So why once again ask for your patience as we are setting up all of these systems, doing so correctly, doing so thoughtfully, doing so in a manner that actually solves the problems we have, rather than just putting something up that's cosmetic. That's the way that we like to do business. But doing business in that manner, especially because the federal solution did not pan out, means that we have to make sure we get it right. And that's why I'm asking everyone for your patience. Hopefully, by the time these systems are set up and fully operational, we will start seeing more and more vaccine coming into the state of Maine. So we will have the happy union of access coupled with more vaccine. But those days, those times are still a little bit ahead of us. And so in that meantime, I once again ask for your patience and your cooperation. Please know that we are working as fast and as diligently as we can to get all of these things set up so that when they're ready to go, they're useful and usable by everybody. One final note before I turn to our colleagues in the media. In recent days, Maine CDC has received reports of phone calls coming in from an 844 area code number. The folks who are calling from this 844 area code number purport to be either contact tracers or people claiming to be confirming a vaccine appointment. In both instances, these individuals have asked for the person's phone number. They have asked for the person's social security number that they are calling. I want to remind everyone that Maine CDC contact tracers do not and will not ask for your social security number. If you get a phone call from somebody who claims to be a contact tracer and asks for your social security number, or you just get a bad vibe about them, feel free to hang up and dial the main line at the Maine CDC, or to ask for the number that you can call them back at. If that number is not what you see on the Maine CDC's website, please be skeptical. If you are being asked for your social security number from somebody who is claiming to know things about you, whether they are a contact tracer or whether they are calling to tell you that your vaccine appointment has been confirmed, it's reasonable to exercise a skeptical eye. Don't ever feel shy about asking that person for their ID number or asking that person for a phone number. And if that phone number is not what you see associated with the Maine CDC, your doctor's office, your local hospital, please know to be skeptical and exercise extreme caution. We have already reported these reports to the Attorney General's office, to their Consumer Protection Bureau, but I wanted to make sure to remind everybody, often and unfortunately, as we've seen during the times of COVID, there are individuals who will take advantage of concern and anxiety and fear and use that to potentially perpetrate scams. Always be on the lookout, especially if individuals are asking you for private information like your social security number. So with that, we're going to turn things over to our colleagues in the media. The first question of the afternoon goes to Patty White.
Thanks, Dr. Shaw. Can you give us an update on the total number of people in phase 1A since it was expanded a few weeks ago? And how close are we to completing vaccinations for that group? I think the goal at the time was to complete it by February.
That's right. With the addition of law enforcement, as well as certain individuals who are critical for the statewide COVID response, for example, folks who might be making swabs, that number of total individuals stands at about 143,000. It's previously about 130,000, but the addition of those groups bumped it up a bit. So it's at about 143,000, Patty. In terms of the completion, in fact, just yesterday, we were having conversations again with independent hospitals, as well as medical associations and the hospital association, to check in with them about what they have been hearing in terms from their members about where there are access challenges for clinicians who are independent and not associated with the hospital. I don't have an exact number of the percentage of 1A that we've completed. I can check in with our vaccine team to see where that is, Patty. But from what we have heard, this is a bit, this is just anecdotally reported. We have not heard systematic challenges from individuals in 1A in making sure that they can get vaccinated.
Okay. And the US CDC is now saying it's okay to give the second dose of the vaccine up to 6 weeks after the first dose. How might that affect the rollout here, if at all? Is that something that you envision Maine doing?
Patty, I think it's really important in this situation to read exactly what the CDC put forth. This is not a baseline recommendation for everyday vaccination. What the US CDC said late last week was, in extraordinary circumstances, if there is a delay between the first dose and the second dose can be administered in extraordinary circumstances as late as 6 weeks after the first dose without needing to repeat the entire sequence. This was not, again, the everyday standard medical practice. This was in recognition that from time to time, in extremely rare and limited circumstances, there may be a delay between that first and second dose. And their guidance was designed to answer the question of whether the first dose needs to be repeated. And within that 6 weeks, it does not need to be repeated. But the CDC has not changed its position on the necessity or the advisability of having both doses, the first and the second dose. So I just want to be really clear about what they said. This was, again, not a change in recommended daily standard practice, but just in recognition of extremely rare, limited circumstances.
Okay, thanks.
I'm going to turn it over to Chris Costa at News Center next.
Dr. Shaw, thanks so much for taking our questions today. I have a couple for you. Hopefully they're pretty easy, just yes and no's. Do you know at this point when vaccines might be included as a travel exemption, the way quarantining and negative testing are?
Sorry, Chris, I didn't hear you that well, but I believe what I heard you ask is there a time in which in the future, having been vaccinated could serve as a basis to not have to quarantine or test if someone is a traveler? Is that accurate?
Yes, it is.
Okay. Yep, there hasn't been any final analysis, the conclusions made with respect to that question. I know from talking with my colleagues at the US CDC, they are looking at that and analyzing the data there. So we haven't made any final determinations for travel. we ourselves are looking at the general implications for having been vaccinated for things like quarantine and testing, which is a different question from travel. But as to the travel, there hasn't been any final decisions or determinations. We want to look at the totality of the evidence. We're also looking to see what the US CDC, what their analysis shows as well. So at this time, no final analysis or determinations there.
Got it. And then another very quick yes or no. Do you know, under the phase 1B description of people that are eligible to get vaccines, once that portion becomes active, it mentions grocery store employees. And we got a question about, are food pantry employees going to be included in that phase 1B, like a grocery store worker or a critical frontline worker, given that they're providing aid to people who need it and face lots of people given in a single instance?
Sure. Chris, just to restate your question as I heard it, your question is, to what extent will workers and volunteers in food pantries be considered as part of 1B when we get to that phase? Is that right?
That's correct.
Okay. I don't have an answer for you on food pantry workers and employees and volunteers at this time. That question has come into us as well, as have a number of individuals who work in different areas across Maine who are helping people in a public-facing manner, asking whether they too would be part of 1B, given that frontline efforts to help others. We haven't answered many of those yet, partly because, Chris, for that type of 1B, which is to say those frontline essential employees, well, right now, our focus within 1B is very squarely on those 70 and over. And then thereafter, those 65 and over. And then at some point thereafter, individuals with various and different types of chronic and serious medical conditions. And so for that reason, it may be some time, based on how much vaccine we get in, before we are with speed and gusto vaccinating those frontline essential workers. So I just want to caution, Chris, that time is still somewhat in the future and driven almost entirely by the supply of vaccine. That's why we are taking in a lot of those requests we've received for folks to know where they might be and which phase they might fall in. And we're going to look at them in total, because right now we're really just focused on 70 and above.
Understood. This next question is speaks a lot to what you were talking about in your opening statement. Obviously, there are people very interested in getting the vaccine. We're hearing some reports of people traveling long hours from some sections of the state to other sections of the state because they've been able to get an appointment at one of the clinics that might be very far, several hours away from where they live, outside of their county, so on and so forth. Do you have any guidance or recommendation for people? Is that something? I know that the goal is to increase access to the vaccine, but it also seems like that might be taking away slots from people who live in that area who might not have the same capabilities to travel farther. Do you have any recommendation or guidance for Mainers on this front?
I do, Chris. I was going to talk about this today. It ended up on the cutting room floor for my notes on Thursday, because I wanted to talk about the access challenges that we know have come up. But since you asked, I do have some guidance and some recommendations and asks of folks who are traveling long distance. Let me go back to the scheduling itself. We've received reports from hospitals as well as other places that a number of folks are putting themselves on a number of different pre-registration lists. They're calling to numerous hospitals to get themselves on any list they can. And I understand why they're doing that. I absolutely get that. You want to try to get a reservation at every table just so that whenever the first slot comes up, you're ready to go. But that can pose challenges. For one thing, it means that the lists are quite large and difficult to work with. It could also mean that if you're given a space, you may not show up for it, which poses challenges for the place that's giving out the vaccine. So my ask for everyone is, please don't put yourself on multiple lists. Use your local hospital, put yourself on their list, and hope that in the near future, there will be vaccine available. Putting yourselves on multiple lists could cause this sort of mismatch between supply and demand, because one of the things that we look at as we are thinking about where to allocate vaccine to is how many folks do they have waiting? And if a lot of those folks have just arbitrarily put their name on the list, we may be led to make an improper allocation decision. The other thing, Chris, is that we too have received reports from folks in York County driving up to Aroostook County to be vaccinated. Again, I get why they're doing that. I'm delighted that so many folks want to be vaccinated. I don't have a specific recommendation on the propriety of doing that. What I will caution, however, is that my expectation and the expectation that we have conveyed to hospitals is that where you go for your first dose is where you also go for your second dose. I got an email from a physician in Aroostook County over the weekend, or a hospital administrator saying, yeah, we had someone come up from York County, and when we asked them what they were going to do for their second dose, they said, oh, I'm not worried about that. I'll just get it somewhere down south. The system is not set up that way. The system is set up such that we send second doses to the same places in the same volumes that we sent first doses. So if you got your first dose in Fort Kent, but you're expecting to get your second dose in Sanford, that second dose may not be there. If you're planning on traveling across county lines in that manner, make sure you recognize that our expectation is that where you get your first dose is also where you get your second dose. I'm going to turn it over to Amy Brown next.
Thank you, Dr. Shah.
You bet, Chris. Amy, over to you.
Hi, thanks, Dr. Shah. Just a follow-up real quick before my other questions regarding having people who think they've received a scam call the Maine CDC. For folks who can't just hop online and find that number real quick, do you either have a number at your fingertips, or could 211 be kind of a clearinghouse for that sort of thing?
I would not call 211 in this situation, Amy. The number that I would recommend that folks call, if they believe they've received a scam call from a contact tracer, not from a vaccine person, but from a contact tracer. If they don't believe it, hang up, and first of all, ask for the person's name and ID number, and then hang up, and if you're skeptical, call the Maine CDC front desk at 207-287-8016 and ask to be put through to the contact tracing team. And then they can help you navigate back to the person who either did speak with you or didn't speak with you. That would be the best way to verify that the call from a contact tracer you got would be the right way to go about that.
Great, thank you. And what kind of time frame are you looking at for the phone system you were talking about? Is that going to be a registration system or a place that directs them to the facility where they should be registering?
Great question, Amy. So it's going to be a registration system. It's not going to be an information system. Again, the problem we've got right now is not a lack of information or about where to go, although that is a problem. The real problem is, how do I get registered? How do I get a date and time on the calendar? That is a little bit more of a challenging type of phone system, phone call center to set up, because we've got to coordinate across multiple sites, different systems, different electronic medical records, different types of providers. So as a result, having a unified phone center that folks can call, one number where you can get registered at a multitude of sites, that actually solves the problem we have. That actually was what the federal government was supposed to have done. But in order for us to do that now and to do it right, it's going to take more time. You know, Amy, I've never sugarcoated or lied to anybody about any of these things. It's going to take a couple weeks.
Okay, great. And one last question. A few weeks back, you provided an update on, I believe there are 3 different vaccines that were in the pipeline, and the Johnson & Johnson and a few others. Can you give another update on where those are, if any are getting close to having emergency use authorization?
Glad you asked that, Amy. The answer is that I actually have a meeting with the US CDC's advisory committee, as part of the US CDC's advisory committee on immunization practices tomorrow. The chairperson of that group, ACIP, called for an emergency meeting tomorrow. It's a public meeting to discuss, among other things, what we believe is on the agenda is the latest data from the Johnson & Johnson vaccine trial. I don't have those data at my fingertips, but check back with me on Thursday and hopefully I'll have an update for you there.
Thank you.
Over to Kevin Miller at the Press Herald.
Great. Thanks, Dr. Shaw. Going back to the question about a phone call center as well as the online registration. I know you said, it sounds like you were talking about the phone center may taking a couple of weeks. How about the website? Do you have any kind of a timeline for when that might be operational?
Probably around that same timeline, Kevin, probably a couple of weeks. Again, we were hoping that the federal solution called VAMS would be the one-stop shop that all states could use for every single vaccine site, whether it's a pharmacy, a hospital, a doctor's office, or a large public-facing site. We were hoping it could pre-register, register, validate, consent, and do everything else on the back end. It can't do any of those things, really. So as a result of that, we are all states, all jurisdictions are looking for different and varied solutions at this time. Again, I think it's going to be a couple weeks. Hopefully, when we have it and we have it in place, it will be that one-stop shop where someone can pre-register, register, go through the consent process, get validation for eligibility, as well as get a date and time on the calendar. I wanted to do all of those things at once rather than be piecemeal. I also want it to be something that the vaccine sites can use on their end to make sure that they know who's coming in the door, that they can report. I wanted to do all of those things because in the IT world, when you have these segmented or fractured solutions, that's where you get data errors and you get drops of information. So I'm looking for one site that can do it all. I know it's going to take time. I'm not thrilled about that. I know that everyone in Maine is not thrilled about that. It's unacceptable, and we're working as hard as we can to make sure we get something in place. But again, I'd also rather do it right than do it fast and slipshod.
I mean, are we looking like spring? I know
no. We're talking no. We're talking single-digit weeks. I'm not going to put a date on the calendar, but low single-digit weeks, low to medium. 2 to 3 weeks, maybe 3 to 4. Okay. Which I know is a long time away. We are still severely vaccine constrained. Again, still only getting about 18,000 doses per week for 190,000 people in front of us, just 70 and over. That remains our principal constraint, but a unified online solution, to get it right, it's going to take a couple weeks. Okay.
And as far as the number of doses that we've received here, I think you may have been asked about this in the past, but so forgive me if this is a repeat question, but there's definitely a huge disconnect between what the number that the federal government, the US CDC, says have been doses administered to the state. I'm looking at their site. They say total distributed to Maine is 195,000 doses, and your orders have been around 135,000 doses so far.
Yes.
Can you explain that?
Yep, 100%, Kevin. The difference there is second doses. It all comes down to second doses. Generally, when I talk about doses coming into the state of Maine, unless I say otherwise, I'm talking about first doses, new doses, because in fact, I was talking with one of your colleagues about this yesterday with Joe. When we talk about doses coming into the state, I think what people are really asking about when they ask that is how many new people can be vaccinated with the supply that's coming in. And so that's why when I've talked about supply constraints, 18,000 doses, that is new doses, first doses coming into the state. There is on the back end on Wednesdays, a separate cache of doses that are delivered for second doses, just to round out the series of vaccination. Those are what the US CDC is reporting. That is accurate, or I believe it to be accurate. I haven't verified the numbers myself, but when I talk about 135,000 doses that have been allocated to the state, I'm referring to first doses, unless I say otherwise. Perhaps I should be more precise and all-encompassing with my language, and I can try to do that going forward. But I'm thinking of first doses because really what's on people's minds is how many new people can we vaccinate now?
Okay. There's just some confusion between what the federal government, the announcement they made or the announcement they didn't make a few weeks ago about this additional doses that were potentially going to go out, and then them saying, oh, we've already given out there's no stockpile of second doses. So
that promise that former Secretary Azar made, and I've talked about this, he promised a cabinet full of vaccines, but when we opened up the cupboard, it was empty.
Okay, right. But so we have gotten these 195,000 doses roughly, but that includes second doses. Okay, great.
That is correct. That is correct.
Thank you so much.
The other thing, Kevin, and I'm going a bit long here, but it's important to level set on how these numbers, what they mean. The US CDC, and I've spoken with them about this last Friday, they acknowledge there is a little bit of imprecision in the word they use. They use the word allocated, as does Operation Warp Speed. And in common parlance, when I think we say something is allocated, what we really mean is that it has arrived. I've allocated to you a seat at the table or something. There's something physical that has been delivered. But in the vaccine parlance, allocated, at least as to second doses as well as future doses, does not necessarily mean that those doses have come into the state. In fact, what allocated often means is that a voucher has been created. So for example, the US CDC on their website for second doses automatically allocates second doses at the time that first doses are available. Those doses may not have even been made yet, but instead, when they say allocate, they mean that they have created a voucher in their system such that at the requisite time, Maine can utilize that voucher, I'm saying voucher in quotes, to get those second doses. So allocated in their parlance is as much an accounting description as it is a physical receipt of vaccine. It's in effect a promissory note for second doses that will be delivered 3 or 4 weeks in the future.
Great, thank you.
Yep, I'm gonna turn it over to Allison Ross next.
Hi, Dr. Shah. Thank you so much for taking my question today. So you've discussed kind of over and over the issues that people have been dealing with just to get registered. You say you're working on this website, this call center, but can you share what the role is of the state right now in ensuring that people's requests are being seen and booked?
Mm-hmm. Sure, Allison. What we're focused on there is working primarily with health systems, outpatient clinics, and others that are offering vaccine to make sure that when we receive questions, concerns about those processes, we're following up with them. We don't have the primary role right now in organizing vaccine registration, although we hope to, or finding slots on the calendar, or standing up large-scale vaccination sites. As I've discussed, we're working on all of those things to get them stood up. But as of right now, much of the vaccination effort is being undertaken by hospital systems as well as large outpatient clinics. Our role is to work with them to understand how much they can do, how much they've got on hand, how much they need for next week, and help them troubleshoot if and when problems come up.
Right, and it can be pretty confusing to navigate between all of this. So do you have a message for those 70 or older or their caregivers who are right now trying to navigate through all of this information?
I think my message for folks 70 and older, as well as their family members and caregivers who are working hard to get them that date and time on the calendar, I think my message is two things. The first is we hear your concerns loud and clear. We hear you and we understand and we get that. I want everyone to know that we are working as hard as we can to bring on tools that will not just help you get vaccinated, but also make the process as easy and seamless as possible. My second ask or message is to please bear with us, to please exercise that patience that you've exercised for so long throughout this pandemic, to bear with us a bit longer while we get all of these things stood up. The corollary of bearing with us a bit longer is don't give up. It's likely that in the near future, the hospital in which you receive care will have vaccine available. I urge everyone there to touch base with their local hospital. Getting through can be a challenge, so it's important not to flood the phone lines, but touching base with your local hospital, perhaps at the number that is on the governor's COVID-19 vaccination website, and talking with them about what they anticipate getting in terms of supplies and how you can register, pre-register with them. That's something concrete that you can do today. I don't recommend calling your doctor's office, but rather try to call or touch base with your local community hospital.
And could you also explain why York Hospital received so little vaccine this week that they actually ended up canceling all signups for appointments?
Sure. We have to balance where a vaccine can be used, where it's needed, and what's on hand. Given that we have hundreds of thousands of people in Maine who wish to get vaccinated and only about 18,000 new doses coming into the state, it wasn't just York Hospital that got a lot less than they could have used. Virtually every single hospital, in fact, for this current week, all but one hospital in Maine, Calais Regional Hospital, every other hospital in Maine and provider got less than what they told us they could use or deliver in the course of this week. And so it wasn't just York Hospital that had to cancel vaccination slots. There was a number of other facilities because as of right now, what we are getting is a fraction of what we actually need.
Okay, and then just kind of going off that point, President Biden is now saying that in the coming weeks, he wants to administer 1.5 million shots a day. Do you think this is wishful thinking or possibly a future that we could be seeing?
Well, I can't speak for how that would be rolled out in other states, but provided that the vaccine and the supplies were made available, I know from my conversations with clinicians and hospital leaders across the state that if and when Maine receives an increase in our weekly allotment, we stand ready to get those shots into arms. So we applaud the administration for thinking big, for thinking bold, for working to increase the supply of vaccine. If and when that happens, we are ready to get those shots into arms.
Great, thank you.
I'm going to turn things over to Mal Meyer at WGME next.
Yes, good afternoon, Dr. Shaw. I appreciate you taking my question. We spoke with a few medical professionals who told us about new, more convenient COVID testing procedures, such as using saliva instead of nose swabs. Are there talks of these more convenient tests coming to Maine once they're FDA approved?
There are. Indeed, one of those such tests, one of the saliva-based tests, is actually coming to the University of Maine, which will be rolling out that saliva-based testing platform for their students, faculty, and staff. Indeed, saliva-based tests are used in other venues across Maine as well, some of which are at testing sites, some of which are in other applications. The Maine CDC laboratory still focuses on doing the nasal swab test for a number of reasons, which we can talk about, but one of which, of course, is that right now that remains the gold standard. Other tests are equally applicable, but we want to see all the data around them. The nose swab-based test is one that has decades of data behind it. We know how to use it, and we know that it is nearly 100% sensitive and nearly 100% specific. So its performance is unparalleled, and it remains the gold standard. That's why we have focused on keeping that test at the Maine CDC laboratory, but that doesn't preclude other types of testing modalities from being used in other parts of the state, as I mentioned, at the University of Maine. As those new and different modalities become validated by the US FDA, we keep taking a look at them to see whether they might be appropriate for any state-sponsored uses.
Okay. And then my second question is about phase 1B, which includes frontline workers as identified by the US CDC's advisory group. Now, on the state's website, it says that this maybe includes teachers or other school staff, but yet the state still says that you are identifying these workers and determining how they will be vaccinated. When might you come to those determinations? When will we for sure say that teachers will be included, and how will they know where and when to go?
Sure, Mel. It will be some time. Right now, the focus within phase 1B continues to be those 70 and older, And then after that group, which again is 190,000+ people, so not an insignificantly small group. In fact, a massive group, more than 10% of the population of the entire state, just in that first part of phase 1B alone. Thereafter, it will be those 65 and older. And thereafter, individuals who have various and different chronic medical conditions. Those are the groups that Governor Mills has prioritized within phase 1B because of their higher risk of death or severe disease. After those groups, which compare all things told, comprise a very large group of the entire population of Maine, that's when we'll start thinking through and working on the logistics of other frontline workers, such as the teachers you mentioned. But given the massive size of just those first parts of 1B, that will be quite some time in the future. I don't know when. That depends on the supply of vaccine. Right now, supply governs speed.
Thank you.
Over next to Jessica Piper at the BDN.
Thank you, Dr. Shah. First, just a quick question. There were some reports earlier today that states might be getting about 15% greater vaccine allocations next week. Had you heard anything of that nature?
We've heard reports to that effect, Jessica, but as with so many things COVID related, especially vaccine related, until those numbers are locked into the system that we share with the federal government, and we know that they will not change, it's not something that my team takes to the bank. We're hopeful and we're encouraged by that news, but again, until we see it locked in the system, it's just hope and encouragement, not a planning assumption.
All right, thanks. And then it seems like the overarching issue here remains a shortage of vaccines. But we are seeing that there are several providers in the Portland area who have enough vaccine to start vaccinating patients over 70, but none in Lewiston, none in Washington County. I know you mentioned trying to get vaccines into arms as quickly as possible, but I'm wondering how you're considering equity alongside that, especially if people are being encouraged to get vaccinated at their local hospital.
Sure. Jessica, I hear what you're saying. I hear what you're saying with respect to Androscoggin, Washington counties, but I would really want to take a closer look at the data before I either agree or maybe disagree with your summation there. Just in the past couple of days, we've moved doses, or in the past week, we've moved doses from different parts of the state to Lewiston, Auburn, to Central Maine Medical Center, and we've also been careful to this, or actually, I think most weeks, make sure that there were allocations going to, for example, Calais Regional Hospital, among other places, initially for their own workers, then for those in the community who are clinicians, and then more broadly. So you may have received reports to that effect, but I'd like to take a look at those data again before I either agree or disagree. But more generally speaking, equity is a part of how we approach allocations. Now, there are many different axes along which equity can go. Some of it is geographic, some of it is population-based, some of it is of course along racial or ethnic lines. So we try to take all of the various forms of equity in mind to try to get vaccine to a bunch of different places all the time. That kind of goes back to the earlier question about why a certain hospital didn't get as much vaccine as they could have used. That is unfortunately a byproduct of not having enough vaccine for the state. The question we face is whether we give a few places a lot of vaccine or give a lot of places a lot less than they would have otherwise been able to use. The latter approach puts equity front and center. Better to give everyone a little bit rather than a few places a lot. And so that's generally how we go about it. Every week we post exactly who is being allocated vaccine for the subsequent week. And if you take a look at that, you will see that sites from Fort Kent all the way down to Southern Maine, every single week are receiving vaccine. It's not every site, and it's not the same sites every week. We do rotate it a little bit so that everyone is getting a little bit. That's essentially how we focus on equity. The other thing we do is to move doses around. The list that we publish on Thursdays is not the final end all and be all of where vaccines end up. If we see mismatches throughout the week between vaccines, vaccinators, and patients, we move doses around. Indeed, just over the weekend, we started seeing a mismatch. So I started moving doses around on Saturdays because there were folks who were ready and able to be vaccinated, but they didn't have enough vaccine. So it's a constant and dynamic process, Jessica. There's not a formula where we put numbers into that tells us the right allocation. We're always adjusting it.
And you mentioned moving doses around. Do the lists that you guys post online get updated when you move those doses?
It does not, because those movements, those transfers are occurring virtually, they're occurring every day, multiple times per day from different sites. We're taking vaccine from A to B and then moving another vaccine from X to Y and then so on and so forth. So we don't update those lists because it would be, the list of arrows would look like a pile of spaghetti.
All right, thank you.
Now, I want to be clear, we're keeping track of it on our end because second doses have to follow suit with the first doses. I don't mean to suggest we've lost track of it, but updating that list with the latest allocations would be, it would be a spreadsheet with a couple hundred tabs on it. I'm going to turn over to Brian Sullivan next.
Thanks, Dr. Shaw. We talk about being supply constrained and the cupboards being bare and the national stockpile. I know it's not your purview, but could you give us any insight as to how the process of making the vaccine and how long it could be before that there might be more available in the United States? Yeah,
Brian, I can only share with you what I've been briefed out on by the US CDC and Warp Speed and what I've read. So I'm not a primary source or a primary point of knowledge about this, but what I've been briefed out on is there are extraordinary efforts underway, which the Biden administration is taking a lead on to increase vaccine supply and production as much as possible. Whether that is through new vaccines that may be authorized, as you heard from Amy's question, there are some promising vaccines on the horizon that may or may not be authorized, as well as to up the production of the two that have been authorized. What I've been told is that those facilities are producing as much as they can right now, but are working with the administration and others to try to expand the number of sites that they have. For example, Pfizer right now is doing their production at a facility in Michigan, but they're working to see if they can bring other sites online. Brian, I think the question really behind your question is when will those efforts bear fruit? I don't have a great answer for you there. Let's hope soon, but I just don't know.
I guess another question off the different topic, any information that your blood type plays a role in how coronavirus affects you?
Yeah, Brian, early and then throughout the summer, there were a series of publications that speculated that blood type may play some role in individuals suffering worse consequences of COVID-19, and it wasn't clear from the papers, it wasn't clear with whether certain individuals with certain blood types did worse or whether other individuals with blood types better. It's unclear whether it's one or the other. I have not really seen any conclusory evidence on those. The papers that were seen were drawn from very high-level population studies. They were often not replicated. I don't think the theory is spurious. It could plausibly be the case. COVID-19 and the coronavirus operate in myriad and mysterious ways, but I haven't seen anything definitive. So I'm not taking it to the bank that your blood type may play a role. If it does play a role, Brian, the role is probably marginal.
Thank you.
Over to Evan Pop next.
Hi, Dr. Shaw. Thank you. I wanted to ask about race data from vaccinations in Maine, and just a couple of questions on that. I wanted to clarify first if that data that'll keep track of the race of people vaccinated in Maine would be included in that general kind of scheduling system that you're talking about, the kind of catch-all website, or if it would be kind of in a separate system. And overall, I just kind of wanted to check in on the process of setting up a system that keeps track of that race data, and whether that data will go back to the beginning of vaccination in Maine.
Sure. So Evan, reporting and collecting information on race and ethnicity of individuals who are being vaccinated is required by the US CDC. As part of the agreement that Maine CDC has with providers, we in turn incorporate those federal requirements, namely to collect name, age, gender, but indeed also race and ethnicity data. It doesn't always happen. for a number of reasons, and we've been working with providers to ask them to make sure they are doing everything they can to collect those data. Sometimes it's not collected. Sometimes the person declines to offer it. So we're working to try to get that data set as robust as possible so we can have a good view into who is being vaccinated in Maine along every line: age, race, ethnicity, gender, location, etc. Right now, how we portray those data, and we're hoping to have that up on our website very, very soon. We'll portray those data on our website, and they will emanate from our overall data set that keeps tabs on where folks are being vaccinated, by whom, so on and so forth. That is a priority for us, though, because we want to make sure that, again, going back to earlier question from Jessica, we want equity to be front and center in not just how we allocate vaccine, but also in how providers are vaccinating folks as well.
So that would be kind of up and running before the other website that you're talking about. That's kind of how I'm interpreting that?
That is correct, Evan. The data facing website, the dashboard, we're hoping to have that up, gosh, maybe even as I am speaking, but I don't want to overspeak and overpromise. But we're down to the last couple of hours getting that dashboard set up, and that will be the front-facing repository of all of the information that we have around who is being vaccinated in Maine. What you're referring to is collecting that information, whether we do that during the registration process or at the point of vaccination. We haven't quite sorted out what the most efficient way to do that is right now.
Great. And then just one other question. I wanted to get a sense of whether or not, from the data so far, school sports have been a significant driver of COVID cases in Maine, or if not so much, have there been outbreaks and cases associated with it? Yeah, just kind of.
Mm-hmm. Yeah, Evan, I'll speak both Maine specifically and then more generally. And both in Maine as in generally, there have been cases of COVID-19 as well as outbreaks of COVID-19 associated with school and community sports. Fortunately, they have been relatively small. We've been able to intervene upon them quickly and prevent wider spread transmission. That's been a pattern that we've seen not just in Maine, but in states across the Northeast. Not long ago, I was chatting with my counterpart in another Northeast state, and we were comparing notes on the types of outbreaks. This particular state, New Jersey, had seen a number of outbreaks associated with school and community sports. Thankfully, our numbers in Maine had been smaller. That's one reason we took steps, the administration took steps to move forward with community sports in recognition of the fact that although there have been cases, and indeed there have been outbreaks, we also, all throughout COVID, were balancing. If I had to summarize everything that we've done as a state throughout COVID, all of us, it's been balancing. We've all had to balance different areas of our lives between staying connected and not being isolated, between X and Y. We too at the state level have had to balance, and school sports are part of that balance. There's an undeniable benefit to that, but we also have to acknowledge that there's a risk. Overall, as we've seen the data evolve, as well as the work that those who are involved in those leagues, we believe that school sports, although they are a risk, is one where the benefits outweigh those risks.
Okay, thank you.
Mm-hmm. To round us out for the afternoon, I will turn over to Patrick Whittle.
Thank you very much, and happy Tuesday. My question pertains also to the rollout. The new administration in DC is only a week old, but have you noticed any marked difference in how the new administration is handling this? And do you have any thoughts about how the change in administration could play a role in this, especially since VAMS was developed by the previous one?
Yeah, Patrick. Let me first say that just in the past week, I'm very encouraged by what I've seen, heard, and discussed with the new administration. There is a clarity of thought, there is an openness, there is a desire to work with states at almost every level, whether it's testing, contact tracing, school policy, and of course, to your question, vaccines and vaccination. Perhaps the most concrete therein has been the openness to the administration in engaging in pre-decisional deliberation with states, basically checking in with us to see whether an idea has merit and will have legs before they actually implement it. That in and of itself has been a notable change just in the first weeks of the new administration. And no doubt, and I speak for my colleagues across the other 49 states, it is a very welcome change.
What has been the problem with VAMS? Because as I understand it, it's still operational.
It is operational. It was a situation where the practice did not live up to the promise. It was intended to be a flexible, dynamic, one-stop shop that did all of the components that I think of that are required to get somebody vaccinated. Pre-registration, and then converting pre-registration to registration, validating eligibility, the consent process, the actual scheduling of the vaccine, the vaccination, and then the reporting out. And what we've seen and what our vaccine immunization team and our IT teams have seen with VAMS is that, for example, let me give you a very concrete example. As of last week, Patrick, VAMS was not ready to be eligible for people in 1B. We're ready for 1B. It started a week ago in Maine, but VAMS was not ready. If we had gone with and stuck with VAMS, we wouldn't have had a scheduling tool for anyone 70 and over. That's just one concrete example. Late last week, I heard from my counterpart in another New England state that did go with VAMS, and they were begging for an alternative solution. And she, in fact, called me to get my take on what else is out there.
I see. Has there been any discussion of curtailing or closing any of the existing sites, or is the hope to just sort of, stick it out until the rollout sort of comes closer to catching up with the need?
I think it's the latter, Patrick. I hear where you're coming from, which is that if sites have taken this extraordinary effort to set up, and indeed some sites have had to curtail or cancel appointments, why have them open? My view is that there's an immense amount of work, and I commend the hospitals and health systems that have stood up these sites. Those sites we hope will not go to waste. We hope that at some point in the future, to Brian Sullivan's question, I don't know when, but at some point in the future, supply will not be our constraint, and that the work that's gone into setting up those sites will not be for naught. It will be able to be, those sites will be able to be utilized. They'll be able to have their maximum throughput and churn out as many people as they plan to every single day.
I see. So right now they're dealing with these supply constraints as everyone else is, but the sites themselves are here to stay and until supply catches up.
That's my preference. That's my recommendation for anyone out there who's taken a lead in setting up one of those sites. Please don't give up on us. Don't give up on the vaccination supply pipeline. We're hoping that there will be doses available so that we can start furnishing you and your teams with the vials to get shots into arms.
I see. One final thing regarding, you mentioned the phone scams earlier in the call. Mm-hmm. It sounds like some of these can have to do with contract tracers, but others are concerned false promises of availability or scheduling of being able to get one of the immunizations, which sounds like somewhat of a trickier thing for people to avoid because it might be a call they're expecting. So
indeed,
I guess what I'm getting at is what can people do to avoid giving someone who would do something like that sensitive information?
Indeed, Patrick, the reports that we got, and these were due to Maine citizens calling Maine CDC to report these to us. So I thank the folks who called into us to say something is afoot here and it doesn't smell right. And we looked into it, and this is what we found on our end. And we again have reported it to the AG's office. But indeed, the reports that we got from Maine people were that as it relates to vaccines, the calls were even more insidious. People were calling to confirm, which again plays on people's hopes that they already have a place in line. And it's really, it's inhuman and unacceptable that anybody would do this in a time of fear and anxiety. What I recommend is that if someone calls you and says, it's your time in line, what's your social security number? Ask them, what hospital are you calling from? What clinic are you calling from? Because if it doesn't sound right to you, then hang up and call the clinic back. If it's your doctor's office, but they won't tell you who your doctor's office is, or if it's your local community hospital, but they won't tell you what the name of your local community hospital is, that's a major red flag. And if you've got any concerns, hang up and call the hospital directly. If it's legitimate, that'll be the best way to verify your eligibility.
So what these people are doing is they're calling, attempting to find people who are waiting in line and telling them, this is your time. Here's the information you need to give to me to be able to access it.
That's correct.
That's
That's
not
correct.
Really nice.
It is about as bad as it gets. It is about as dastardly as I can imagine someone doing. Given that from the reports we've received, they seem to be calling older folks who, of course, are anxiously and eagerly awaiting their place in line. You know, I mean, when I hear stories like that, I just think about if one of those folks called my mom, and my mom would say, "Thank goodness, I can't wait. What do I need to do? Here's my social security number. Whatever I need to do, I will do." And so it's you know, there's a special place in hell.
Yeah, they should find something else to do with their lives than that, like literally anything.
Yep.
Well, thank you for addressing that.
You bet, Patrick. And thank you all for your questions this afternoon. And thank everyone who's watching for taking some time out of your afternoon. The news I reported today was not good. The number of deaths continues to go up in the United States, far surpassing what we've experienced in the bloodiest wars of human history. On top of that, we know that folks are struggling to get places in line for vaccine. We hear those concerns. We know that it is not easy right now. I want everyone to know that this is amongst our top priorities at the Maine CDC to work on these systems, to bring things online, to make it easier for you to get registered, to get scheduled, and eventually to have a date and time on the calendar when you can go and get vaccinated. Things will hopefully get better before not too long, but in that meantime, I ask everyone again to bear with us. We hear your concerns. We are addressing them as quickly as we can, but we will try to make sure that when we go live with solutions, they are right and not just fast. So with that, thank you all for your time this afternoon. I look forward to chatting with everyone again on Thursday. As always, please be kind and take care of one another.